Good evening, everybody. My name is Anjana Satpathy. I'm one of the consultant breast surgeon at BMI Alexandra Hospital. Today, we're going to talk about breast health essential. We do MOT for our rest of the body, but today we're going to focus on how to look after our breast. So I have a disclaimer. This is purely for educational and awareness purpose. There is no financial interest linked to this presentation. So breast is it's a symbolic for feminism. But in addition to that, I think breast is very dynamic. It keeps changing from puberty through the pregnancy and menopause and beyond. This is the organ that never stops changing. And therefore, it also invites lots of problems. Just to highlight the fact that breast cancer is very common, therefore the awareness is very important. It's 1 in 8 women breast cancer could affect in their lifetime. However, if we talk about men, it's 1 in 800 men. 3 years ago, when they counted all the data, in the UK itself, over a year, we diagnosed 55,000 cancers. And unfortunately, 10,000 couldn't make it a few years. So therefore, it is important to know your breast. Not only there is problem with cancer or anything, but overall breast health is very, very essential. So this topic is essentially know your breast and know some tips and pearls. So these wonderful ladies tell the entire world that this is a disease. It could affect to anybody, despite your fitness, despite your background. It can happen to anybody. And they have also shown that how courageously they all received treatment and spreaded the information that catch it early and you can beat it. So this is a program or a motion that was essentially addressing American ladies to understand, know your breast, know your lemons. They compared breast to lemons. So if we think about how a lemon should feel when it is fresh and how a lemon should not feel or should not do if there is a dimple, if there is a problem, if there is a change in color. Over the period of time, like from puberty to postmenopausal, your breast changes. Therefore, we need to focus on what are we looking for in a breast and what we all should be concerned about. So we worry about cancer. So the concept of catching it early could aim for complete cure. So I always say, when you have any problem, when you think there is something wrong with, there are lots of help available. The first point of contact is your GP or practice nurse or midwife if you're pregnant. When they refer you to us, as a specialist, we not only examine you, we offer some tests in the form of mammogram, ultrasound scan, and you'll know or surprised to know that at least 8 out of 10 patients who come to the breast clinic, they have all normal tests. So what happens next? If you have a normal test, but you still go with some symptoms. Therefore, I think understanding is important. And therefore, prevention is better than cure, as we say. We understand, we prevent the problem. So are there any risk factors? How do we find out whether we are more susceptible or not? Okay, in the UK, we have a breast screening program that they send out letters between the age of 47 to 73 to have mammogram every 3 years. And also, there are family history clinics who identify the people who have high chances of having breast or ovarian cancer. But in addition to that, what are the common recognized things that we can see? Nowadays, if you think all the girls are having their menarche, the first menstruation cycle, very early in the age, I think for some reason, due to environmental change, the girls are getting it very early, as early as 9, 10-year-old. So what early menarche and late menopause do? Your body is exposed to a lot of hormones. Therefore, the more hormone it receives, the chances of having a problem is more. So if you're planning to have children, I would recommend don't delay your first pregnancy, because once your body is interrupted with those estrogen, then you get a benefit of your body having less sensitive to cancer-related issues. The other common obesity, smoking, alcohol, as they are risk factor to other problems. If you are taking any HRT or any cream, any additional estrogen, and if you are taking them for long term, maybe more than 8 years, more than 10 years, there are some cumulative risk. Therefore, if you are doing that, then maybe think of weaning off, because there are lots of things we can do to prevent the problem. So in the next slide, I will look into a few do's and don'ts, and I will also explain how we can do the examination by ourselves to raise more awareness. What are healthy breasts and what are the signs we are going to look for? I need to highlight this one, family history, because if you have a breast or ovarian cancer in the family, although you'll be glad to know that family history only adds 2 to 3% of breast cancer. The rest, 95 to 98% of cancer can happen to anybody without any family history, without any faulty genes. So if you have anybody in your family, like a first degree, we call mother, sister, daughter, with cancer onset less than 40-year-old, or any male members having breast cancer, or multiple members, including first, second degree relative, distant relative, cousins, having lots of cancer in the form of breast cancer, thyroid cancer, then these are the situation. We need to go out and talk to the GP, and there is a procedure. These people can go to family history clinic for risk assessment and see whether they are eligible for early screening and risk reduction procedures. So these are more important if you have anybody, and then you need to think about it, whether you are in the low risk or intermediate risk or high risk, and then what to do next. Now I'm going to focus on self-breast examination, which is most important thing. All women only do if something hurts. Nobody examines, probably, I mean, that include myself. We don't examine routinely every day, because unless it hurts, unless something different, we don't look at it. But as the risks are getting higher, it is useful to understand that your breast is like a clock. How to examine? Check once a month. Think about the breast, 12 o'clock to 6 o'clock. You need to examine all the way, surrounding upper and lower, and also nipple and areola behind it. And if you're premenopausal, the best time to examine is a week after the period. And if you are having some symptoms, if you're not sure about it, I would recommend monitor a diary or a log, and then look for something in the following cycle. If you are postmenopausal, then just find a date or week in the month that you would like to examine. What are we looking for? We're looking for if there is a lump, if there is change in texture, if there is a dent, if it is something hurting that wasn't hurting before. If the nipple are crusty, or if the nipple going inside, or if there is any skin change or color change, or anything that was not there before. But if you can see this slide, you need to look into yourself in the mirror, if you have one, and see if the nipples are aligned or not, and the fold of the breast, if there is any dent when you're raising your arm. And then your right hand, examine the left side as a clockwork. And similarly, left hand, examine the right breast, both lying down and sitting up position once a month. And if you find something different, if you find somewhere particularly you're not sure about it, then yes, ask for help. What I'm going to talk about when you don't feel anything, nothing there is but it's hurting you. I think almost all women, we all experience breast pain throughout our life at some stage. Some people get it when they are young, some people get it when they are pregnant, but pain is something that keeps coming and going. So when we call it cyclical, it's specifically around your menstrual cycle. And when it is non-cyclical, it can happen any time. It may be related to what you are doing, what job you are, if you are on the desk job, and it might be because of the posture, because of the pain and discomfort in your ribs, or if you're having any heart problem or a lung problem, if you have any underlying something called, we call COPD, or any heart condition, that could cause pain in the breast. So what we normally see, people come with breast pain and their tests are normal, they go home, but the pain doesn't go, it keeps coming. So I'm going to focus, what should we be doing to reduce breast pain, tenderness? People find it difficult to hug their children or hug their grandchildren because the breast can be very sore. So, as I said, if you are a working woman and if you have a desk job, or if you have a very highly active job, you are lifting things. So nowadays, ladies are doing working from, say, cabin crew to post women and to delivery. So there aren't any just specific job. They are doing a variety of job. Therefore, posture is important. Always think the breast can be heavy, and if your shoulders are a bit droopy, you can get pain and discomfort in one particular area. Therefore, I always recommend, check yourself, tell yourself, am I actually sitting properly? Am I standing properly? We have a natural tendency to slouch. And if your breasts are uncomfortable, you slouch even more. Therefore, posture is most important. Second thing, bra. Often I ask my patients, when did you have last measured? They said, I had anything that fits, but there are bra fitting service. If you're having discomfort, tenderness, pain regularly, check, are you wearing the right bra? Some of the bra can be very, very tight, and they can stop the fluid movement in the body. And by evening, it is very heavy and tender. So if you are having problem in the breast, especially pain, tenderness, then first and look, foremost thing, check, are you wearing the right bra, right size, comfortable? And then certain dietary factor. Excessive coffee, chocolate, fizzy drinks, and fried food can cause pain in the breast. Why? People ask why. What is that? Because caffeine or chocolate, they can cause hardening of the breast tissue. And with our hormonal fluctuation, the breast tissue gets very hard. And hard breast tissue is very, very painful. Smoking and rigorous activity, lots of weightlifting without a protected bra or supportive bra can cause breast pain. I just highlighted about hormones. If you have been taking them for a long time and you are developing new pain and discomfort, worth changing and talking to your doctor whether you need to change the make or go to mini pills or something else that is suitable to you. This is the recommendation for general breast pain management. Bra posture exercise. And I recommend evening primrose or star flower. These are some nutritional supplements. What does it got? It's got something we call essential fatty acid, gamma-lenic acid we call. It stops those external hormones to make your breast hard. So it helps to make your breast softer. And a softer breast is not painful breast. So the aim is to take it for a few months and see if it is working. In my practice, I see at least 8 out of 10 women If they are having pain and discomfort in the breast because of cyclical issues, because of hormonal fluctuation, evening primrose help them a lot. It not only that, it helps to glow your skin and the other health benefits. Some people who have tenderness in the rib, especially postmenopausal women with underlying something we call thin bones, osteoporosis, arthritis, the ribs, we recommend some pain relieving gels on and off in addition to a comfortable bra. If you find your breasts are heavy by evening and you're having pulling sensation, then I would recommend sleep in a bra, in a vest type bra, comfortable bra. What does it do? It gives a bit of elevation, and that elevation reduces fluid retention in the body, and your breasts are softer in the morning. People who have constant pain in the form of neuropathic pain, back pain that radiates to chest wall, they recommend aquapressure reflexology helps in this intractable breast pain. Previously, say 20, 30 years ago, women were given anti-estrogen medication in the form of tamoxifen for pain relief. But it was realized that anti-estrogen medication has its own side effect in the form of uterine problem, excessive bleeding, clot in the leg. Therefore, I would recommend caution if anybody is taking anti-estrogen medication or any other hormonal supplement for breast pain. Always take with caution. Now, pandemic hit us hard. It is difficult to understand what's happening. So we had patients who had COVID-19 infection. They have persistent pain in the chest, breast, arm, shoulder, heaviness. These are new symptoms of previously fit and healthy women. And following vaccination, we have seen a series of people with pain, discomfort, and lumps in their armpit. Luckily, they disappear after 6 to 8 weeks. But these are the problem people are noticing nowadays. There are some unusual skin rash following vaccination, and this symptoms of long COVID is coming. So these things are going to be more and more clearer as we come to close to this pandemic. I sincerely hope we are getting there. Now, I'm going to focus a few things about pregnancy and breastfeeding, which is always a bit difficult, tricky to examine. But I still recommend, even if you're pregnant, examine your breast exactly the same way as I recommend to non-pregnant women. Although pain and tenderness are common in pregnancy, but persistent pain, lumpiness, redness, if you have any worries, just speak to midwife. And we do see pregnant ladies with lumps in their breast. Some people, after their first or second pregnancy, they develop some swelling in their armpits. And they didn't, it can be worrying because they look different. So these are, we call accessory breast tissue. They behave exactly like breast tissue. They get engorged during breastfeeding, and then slowly and steadily they get back to some kind of normal. Some people always have a bit of extra tissue in their armpits. If you have any doubt, worth seeing your doctor. I think next one is now, it is very essential to talk about breast implants. And if you have problems with your breast implants, symptoms related to breast, how to recognize them. This PIP scandal taught majority of the ladies what we are looking for. We're not just looking for pain, discomfort, or rupture, but we're looking for is there anything else happening. The silicone, when they start seeping through the tissue, they not only go to different parts, they go to your eyes, joints, and they can generate some kind of unusual tissue reaction that can give very, very long-term problems in the form of weakness, fatigue, joint pain, blurring of the vision, implant rupture, rarely some kind of lymphoma, which is close to cancer of the lymph nodes. In the regular setting, if you have implant and you are experiencing pain, swelling, and hardening, then it's worth having a look, because you will need some imaging, some ultrasound scan to see if there is any crack in the implants. And we have people who have breast implant for 10 years, 20 years, they're fine. But when they come for screening mammogram, they get worried whether their implant will rupture if they have mammogram. But I have been to an implant manufacturing company where those breast implants, majority of them, they undergo rigorous testing and compression effect, so that patients will not disadvantages not get with the screening program. So therefore, even if you have a breast implant and you have been invited to attend breast screening mammogram, please do attend. Mammogram is approximately 99% safe for breast implants. In doubt, they now offer you ultrasounds to begin with and then mammogram. But the essence is know your breast and keep checking once a month. If some people have other cosmetic procedure or other operation for anything, any lumpectomy or benign condition, the breasts change in shape and size with respect to scar tissue. Sometimes the scar becomes very swollen and tender. So therefore, if you find any changes which is recent, and then log it in your diary, and if you are in doubt, go and see your doctor. I'm going to talk about a little bit about nipple discharge. What other situation we encounter other than pregnancy and breastfeeding? People with what I normally see, young ladies who had a piercing or some infection, some trauma, they end up, when the scar heals, they end up having nipple discharge. And people who are taking contraceptive pills or depot implant, they can have some nipple discharge. But these are physiological. Smoking can cause infection in the lower part of the duct, therefore you get nipple discharge. Often they can be clear, greenish white, as long as they are fine. But if you notice they're getting brown or some hinge of pink or blood, this is the time you need to worry about. Think about, what should I be doing? But I would recommend, if you are noticing any nipple discharge, please look into the risk factor if you can give up few things in the form of smoking or any home use. And also look whether it's coming on its own or just expression. Sometimes by expressing 3 to 4 women, this can cause some kind of nipple discharge, because it will be traumatic discharge. Majority of the infection or any trauma, the symptoms usually settle within 3 to 4 weeks. But if it's persisting more than that, then you need to see a doctor, because 5 out of 100 with nipple discharge, there might be some pre-cancerous changes just developing. So these are the signs you need to look for. If something is persisting for more than 4 weeks and that doesn't look clear, greenish or white. Skin problems. Majority of have problems in the skin. It could be as simple as eczema or some spots or underfold, underbreast soreness. But what you need to look into it, is it just one side? If there is any changing, any bleeding, any cracking. If you look into that's the other side of the spots are normal. We call aging spots. That is the scientific name of it. If you look into it, if the spots are there, normally people start getting spots after the age of 35 or 40, but they are normal. But if you think the nipple looks a bit red, always compare with the other side. If there is some crust developing, some cracks developing, it's not just usual eczema, then you need to look into whether there is something developing. So eczema of the nipple and areola is very common because of the skin type. So therefore, this area needs to be moisturized. Smoking should be stopped if there is any. And underfold soreness is because of the moisture, so that area needs to dry. So the breast needs a lot of attention. Some area needs moisturizing, some area needs drying. But because it can give you long-term problems. Therefore, these areas need to be looked after. So you know when to moisturize, where to keep it dry, and use some antifungal ointment. You can get it from the counter if you are troubled with fungal infection under breast soreness. If anything persisting for more than 3 to 4 weeks, then that is the time to see a doctor. Breast lump, you can feel it. I say if you feel a lump like a grape, it could be smooth, it could be your gland. If you have lost recently lots of weight, you can feel lump or lumpiness. If anything is there, despite you had periods and still you can feel the lump, then see the doctor. In the NHS at the moment, any woman with breast lump get a referral within 2 weeks. In the private sector, you can sometimes get same-day appointment or within 2 to 3 days appointment. And what we do, as I mentioned in the beginning of our talk, we do examine and we do some testing to get a diagnosis. If we have a biopsy or needle testing, normally we get a result within 7 days, and then the treatment can be planned. Majority of the lumps, if it is under 3 centimeters or under a couple of inches, it can be left well alone. And specialists will advise if there is any indication to have it removed. Some of those lumps, when we also advise that we need to monitor it with scans every year or every 6 months. So it is important to understand, for example, if you have cysts in the past, not necessarily all lumps are cysts. If anything is not going away, staying, then needs to be looked after. I think I would conclude my talk with this slide, because we all need to know why breast cancer is so prevalent, but we need to understand that majority of the breast cancer is treatable. If I say 95% of the people, when their cancer is detected early, live a disease-free life for at least 20 to 30 years. Lots of information are available in the breastcancercare.org. So therefore, motto is check yourself, treat your breast as an important organ, and early diagnosis saves life. I'm happy to take some questions.
Brilliant. Thank you so much, Ms. Satpathy. That's absolutely fantastic presentation. I know I found it very useful. As Ms. Satpathy said, if anyone wants to ask a question now, you can do so within the question and answer chat box. Just before we do that, though, I'm just going to show everyone a quick slide. So if you'll just bear with me 2 seconds.
I'm shared now, isn't it? Okay.
Yes, that's fine. Yeah, that's perfect. I'm just going to share my slide just so that everyone can see this. So what you can see here is just a quick screenshot of the BMI Alexandra Hospital's private breast screening service that we do offer. So this service is available at the hospital. So if you do feel like you have an issue with your breast and you want to be seen quickly as a one-stop clinic, you can come along to the hospital and you can be seen on the same day, and with some tests and services available on the same day as well, so you can get seen as soon as possible. So you can have a look for more information on this at www.bmihealthcare.co.uk, or you can phone our hospital as well, and the number is 0161 428 3656. So I'm just going to go back to you, Ms. Satpathy, now. Give me 2 seconds.
Thank you, Katie. We've also got a question that's coming. Could you, Ms. Satpathy, talk about the physical therapy role in breast care, please?
Is it physiotherapy?
Physical therapy, it says. Physical, so I'm assuming, yeah, exercise or physio or something along those lines.
Yeah, I think, as I mentioned in my beginning of the slide, posture is very important, because any pain in our shoulder, neck and back they all cause pain in the breast. So therefore, posture, and if you have any pain in your shoulder and back, physiotherapy is very, very crucial. Because if your back muscles are weak, you get more and more pain. Because, as I said, women have a tendency to slouch, and that causes more damage, not only to the back, but also to the breast. Therefore, physiotherapy addresses the shoulder muscle, make the back muscle strong, and the pain and discomfort usually go away.
Thank you. And could you also, you mentioned briefly earlier around the hereditary factor of breast cancer. Do you have any stats in terms of what the likelihood is if your parent or sister or somebody closely related to you has been diagnosed with breast cancer? What should you do as a patient? Should you get checked?
Yeah, I think if you have a relative in the sense mother, sister, daughter, we call first degree relative as immediate family member under the age of 40 who has breast cancer or ovarian cancer, or anybody, a male member of the family, or both sides, both mother side and father side, aunties, cousins, they have breast cancer or ovarian cancer. It's worth talking to GP, because GP can send this referral to family history clinic, where they normally send a questionnaire where you have to fill all those relevant forms, and that is going to help us to identify low risk, intermediate risk, and high risk based on the type of cancer, the age as onset. So there is a scoring pattern to give us an idea who would be eligible to have early breast screening in the form of either MRI if you are 30-year-old and you are high risk to have breast cancer, then they provide MRI scan. If you are 40 and above, they provide annual, like every year you have mammogram. So there are specific programs designed to different risk groups, and the family history clinic based at Wythenshawe Hospital, a part of Prevent Breast Cancer, they can provide referral to genetics to get a genetic test based on all the scoring.
Thank you, Ms. Satpathy. Would that be something along the lines of the BRCA testing?
Yes. I think BRCA testing is being modified. In the next few years' time, it will be easier and it's available to anybody who would like to have their genetic test checked. They can have it done.
And is that available on the NHS, Ms. Satpathy, or is that something that you do have to go to a charity or to go private for?
Yeah, it is available in NHS. It is also available in private. It needs a referral from the doctors. For example, a patient requested me because she wanted to know her genetic makeup. So I had to do a referral to the genetic clinic. There is a special form I need to fill and the clinical questions. Yes, they can pay for the genetic test. But having said that, it will only test 2 genes like BRCA1 and 2. Whereas if we need more genetic tests, they need to go to specialist center because they're only done on a few people.
Thank you very much. It's very difficult for you to answer questions around personal circumstances, as you obviously don't have any medical history. But if there's a patient who's been 5 years breast cancer free and they're taking letrozole for another 5 years, would you recommend them adding an evening primrose supplement, or would you suggest they stay away from that?
I think evening primrose can be given to anybody because it's not a medication. The only people who shouldn't be taking if they're pregnant or breastfeeding, because that's somehow not advised. What evening primrose does, it doesn't contradict with any medication, anti-estrogen, because it's a nutrition that keeps the breast softer. It's a diet essentially. So I don't think there will be any harm if they take evening primrose in addition to letrozole.
Thank you. Regarding hereditary breast cancer, can there be patients where they have had very close relatives, i.e. mother or sister, that have had breast cancer, but it not be hereditary? Is that possible?
That's possible. As I said in one of my slides, only 2 to 3% cancers are hereditary or genetically linked. Well, the majority of them are not necessarily hereditary, but we put a lot of factors into perspective. to get the women screened early, because not necessarily all those genes have been classified. So what we know is BRCA1 and BRCA2 gene is responsible for 80% of the hereditary breast cancer. But there are other genes which has not been very clear. So therefore, if somebody has family members, we take them into perspective and provide them early screening if they satisfy those criteria, even if they are genetically negative.
Okay, thank you. Hopefully that helped answer a question. We're just waiting for some more questions to come through. Interesting comment that you made earlier was the way that breast cancer treatment has progressed over recent years, and now that actually having breast cancer, there is quite a positive outlook
Yes.
for patients. And I understand that 20 years ago, I think, did you say 95% of people have a positive outcome? Was that the figure you used?
Yeah.
And whereas 20 years ago, that might have been the other way around, whereas 95% of people didn't.
Yeah.
What is it that's been key to that advancement? Is it early diagnosis? Is it the treatment? What is it?
I think screening, we are detecting a lot of cancers or pre-cancers before they actually become a threat to life. So if you think about the facts and figures, screening itself reduced the mortality to 30 to 40%. So that means we're able to save 30 to 40% of ladies just by screening only.
Okay, so it makes such a huge difference.
Absolutely.
Another question. Some women are suitable to have a mammogram and some women aren't. What would make somebody suitable versus somebody that isn't?
The standards are, if you're under 40, your breasts are very dense. So therefore, dense means the glands are quite a lot. The breast has got glands and fat cells, fatty tissues. So if you have got a lot of gland, the mammogram is an X-ray. It doesn't show much. If you have got good fat, the mammogram shows. So 40 is a dividing line. People get mammogram at the age of 40 and above. Under the age of 40, ultrasound scan. But if somebody has got problems, the mammogram is not conclusive or indeterminate, ultrasound not sure, we go for MRI scan to get more specific, but that's not regularly happen. For a general rule, anybody 40 and above will get a mammogram to begin with, and ultrasound scan if necessary. Under the age of 40, we offer ultrasound scan because the way they look, in the X-rays, the breast will not be looked properly on the mammogram because of the textures and glandular tissue density, we call it.
Thank you. Something that's been in the press quite considerably over the recent years is regarding a link between HRT and breast cancer.
Yes.
So is HRT a contributing factor to breast cancer if a low dose is used? What are your thoughts on that?
HRT, as I said, it has got cumulative risk. So if you have taken over 10 years and over, your body is kind of sensitizing every year to the exposure to the estrogen. So therefore, if you are taking for more than 10 years, it's worth weaning things off. Because there are two big studies, one in Europe, one in America. It showed if you have taken HRT for over 10 years, there is at least 10% chance of you having breast cancer. If you have taken 15 years, 15% chance of having breast cancer. So over the year, the problems the risks get higher. So therefore, long-term HRTs are not recommended by cancer specialists.
Thank you. Is it a better outlook for a patient if they are not HER2+? I'm hoping you understand what that means.
Yes. And breast cancer has got some prognostic factors. Some of them are estrogen sensitive. Some of them are HER, which is a protein sensitive. So as I said, with advancement of technology, anybody with estrogen positive or HER2 positive, they respond well to the treatment. Therefore, the outlook nowadays is better, whereas, say, 10 years ago, we didn't have that much of treatment for HER2 breast cancer. But nowadays, in my practice, in my experience, HER2 breast cancers are getting 100% cure rate after treatment. Almost 100%.
How can early menarche relate to breast cancer?
Yeah.
What is that?
When you start your first menstruation, some people
Okay.
13, 14. So nowadays, for some reason, the girls are getting in very early of their age. Primary school girls, age 9 and 10, are getting periods. So when a period happens, your body is exposed to additionally ovaries secrete estrogen. And so your body is exposed to lots of estrogen. So when your body is exposed to lots of estrogen, again, it's a cumulative risk. So we don't want that much of estrogen to our body. And that could cause in later life, is a risk factor to have breast cancer. Therefore, the interruption of estrogen is in a method of pregnancy, breastfeeding. These are, something that, it's in the literature that these are the preventable factor towards breast cancer. So if you are planning to have children, do it early, not too late. So therefore, your body is now interrupted to the estrogen cycles, so is protected from those cancer effect of estrogen.
Thank you. One of the listeners has asked you if you could repeat how excessive fizzy drinks and coffee can play a role in breast pain. I know you mentioned chocolate as well, which is now really upset me, I have to say.
Oh, sorry. I know
coffee not so
very
much.
happy with me because I tell them, coffee. What is coffee? Coffee has got caffeine, and caffeine can cause the breast tissue very hard, and the estrogen binds to those breast tissue, so the breast gets tender and hard. Fizzy drinks has got similar component. It affects the breast tissues and tissues get harder. Coke, cocoa in the chocolate does the same thing. Smoking cause hardening of the breast tissue. And these are the common thing when you get breast pain, you see what I'm going to take off from my list. So I think I remember I had to tell a patient who used to drink, say, 15 cups of coffee, and severe breast pain, and she came with kind of withdrawal symptoms when she stopped coffee. So it's gradual, decaf it, and then you see the difference. Yes, these are those breast pain problems like coffee, chocolate, fizzy drinks, fatty foods, chips. I know there are lists, and I can't take all the pleasures of your life out.
Talking about smoking obviously affecting the breast, is there any evidence to say where vaping comes into breast pain or breast symptoms? Has there been any evidence to support or negate that?
There aren't any published evidence, but the evidence of nicotine causing breast infection and scarring and later life breast cancer are there. But since vaping is a new thing happening in the last few years, not many published data are available. But something which is not good for your health, for your breast, don't do it.
Okay, yes, thank you. Sometimes those things are quite fun though, Miss Satpathy. If a woman what's the does perimenopausal stage cause breast pain?
Yeah. So again, perimenopausal, that means say between 45 to 55. Yeah.
Yes.
That time our hormones are everywhere. The body, the ovaries are fluctuating, and if you have a little bit of adipose tissue, a little bit of fat in the waist, fat in the thigh, they also start secreting estrogen. So the breast gets tender. And if you are taking HRT on the top of it, or any kind of hormonal supplement, gel, cream, or something, they all attack the breast tissue. So the breast gets sensitized with additional hormone. So therefore, evening primrose is very much recommended And as I said, 7 to 8 out of 10 women do find some benefit because their breasts are softer, so the external hormones are not fighting with each other.
And if you typically experience breast discomfort prior to a menstrual cycle, will that continue through that perimenopausal stage?
That is a possibility. But then by the time you're perimenopausal, your other stuffs are coming into view, like your shoulder, your your ribs, your spine. So it's a kind of multiple factors. Whereas when you are young and you're puberty, you're running around, you're physically fit, but towards perimenopausal, some people do extra exercises. I have people who come, I've recently joined gym, I'm doing this weightlifting, this workout, but you need to look into whether your bones and your ribs are properly maintained. Are you having something called thinning of the bones because of normal vitamin D deficiency, calcium deficiency? After the age of 40, almost all women lose vitamin D and calcium. Therefore, you're having pains and ache. It is recommended to take some calcium and vitamin D towards that perimenopausal area. Those time. Yeah.
Thank you very much, Ms. Satpathy. You've been an absolute tremendous speaker tonight. I'd just like to remind everybody, Ms. Satpathy practices at the Alexandra Hospital as well as Wythenshawe. She's an incredibly experienced surgeon, and I'm sure you can tell from tonight's talk, extremely passionate and compassionate with all her patients. She has clinics available to book into at the Alexandra. We have come to the end of the questions now. There are no more questions coming in, but if anybody does have any questions that they think of following tonight's event, you can either email myself, Vicky Walsh, that's vicky.walsh @bmihealthcare.co.uk, or my colleague Katie, that's katy.wallace, WALLACE, @bmihealthcare.co.uk. If for any chance you did miss any of tonight's events, if you click the link that Katie sent everybody before the start of the event, you'll be able to rewatch the event for up to 30 days after. I don't think there's any more questions now. So, Ms. Satpathy, I'd just like to give you a massive thank you. It's been a tremendous evening and extremely knowledgeable and informative. So thank you so much for giving up your time this evening.
Thank you so much, Katie, for organising. Thank you for getting the opportunity. Thank you. Bye-bye.
Okay.
Have a lovely evening.
Good evening, everybody. Thank you.
Yes. Bye.